Is there criminality? Is there law breaking at the heart of the NHS? I have been looking into this. I want to know more about what's going on. There are active cases. In fact, I'm following the case of an NHS England whistleblower and the legal defence in his case to defend harassment. The legal defence by the NHS is that his contract is not contractual. What an extraordinary statement. This is the statement made in court. It's clearly a laughable defence, but for some reason it has been accepted. I don't understand why. Now, when we look at his contract is not contractual. Clearly this is a case that needs to be reviewed at the highest level. If an Uber driver is an employee, according to the Supreme Court, how could an NHS employee not be an employee? It's in the name. This is just one of a number of cases in the NHS that's being suppressed, and there's a history of giving false evidence by leading bureaucrats in the system. There is a history. And the usual system of evasion and delay is being used to undermine any progress in these cases. Think of Jeremy Hunt's dictum. It's mentioned in the Freedom to Speak Up review of delay, defend, and deny. Delay, defend, deny. And of course, Mr. Hunt is now the Chancellor of the Exchequer. And whether he realises it or not, he's also the personal saviour, the personal champion of spoonerism. What he has managed for Miss Malaprop, similarly, perhaps without even being conscious of his involvement, he has also managed, it would appear, for legal obfuscation. It's very impressive. But this behaviour, I think, undermines trust and seriously compromises the way in which our country, and the health service in particular, can function in the future. And it seems that the trail of misdirection and misdeeds genuinely goes to the top. And I think Mr. Hunt has serious questions to answer. Just how much is he personally involved? Where Kwasi Kwarteng offered the biggest package in history, maybe it could be argued that Jeremy Hunt offers a sweeping sleight of hand that would put anybody in the magic circle to shame. Mr. Hunt has direct control of NHS budgets, and particularly of those budgets for legal aid, for the legal cases, for fueling and funding the legal cases against whistleblowers. It's very worrying. Now let's look at a parallel. Dan Needle was able to track down the Nadim Zahawi story because he was not hampered by the traditional media gatekeepers, by the pressures of traditional MSM, mainstream media. That's an acronym I've only just learned. Mainstream media. Even so, he had, there was a documentary the other day. He had the traditional frightener letters telling him to back away. He didn't, and it's clear that whatever explanation Mr. Zahawi may still provide, and we wait to hear what that might be, there is something that needs explaining. It cannot be dismissed. Dan Needle has found something. I feel the same concerns can be expressed about the whistleblowers who have experienced and witnessed serious abuse in the NHS. The knee-jerk response by the NHS has been for them to be dismissed, along with the most bizarre legal defence that an NHS contract is not contractual. We need to get to the bottom of what appears to be an abuse of power, because this is going to suck the lifeblood out of the NHS. Let me give you an example. Another example. £10 million was spent by Jeremy Hunt, when he was chief executive of the NHS, resolution. £10 million was spent by him to silence Dr. Raj Mattu, a cardiologist who raised disclosures about patients dying unnecessarily. And it was finally settled for £1 million. Now, how many nurses and doctors, how many nurses and doctors, how much equipment could be purchased with just a fraction of that money? £10 million wasted in a legal quest to stop a whistleblower. The problem is that sort of bullying is rife. You know, we've now got bullying allegations that are outstanding against Mr. Raab. The questions hovering around Mr. Zahawi are also the sort of questions that are threaded through the NHS, the police force and education. You know, it's all about elitism and arrogance and hiding. Our systems are collapsing because of the network of favours and glad-handing that may just amount to preference, but it may also hide serious corruption and criminality. We need to see some light in this darkness. We need to find a way. We need to cut through the obfuscation. And we need questions answered. Now, it may be that Mr. Hunt has perfectly good explanations. It may be that Mr. Zahawi has perfectly good explanations, but the silence is deafening at the moment. We need explanations. And we need the cases which are outstanding and which are being frustrated. We need those cases to be opened. We need them to be heard now.